Hello, my name is Chelsea Moyer, and today I am going to be presenting on West Virginia Senate Bill 787 as my policy brief final presentation for HPML 601 Health Policy, Law, and Ethics. So, what is Senate Bill 787? This is really in regards to pharmacists being able to bill for services that they're providing. So, in Senate Bill 787, it calls out commercial payer non-discrimination, or you may hear it in layman's term called provider status protections for pharmacists. The bill requires commercial payers to reimburse pharmacists if they would be paying another practitioner for the same exact service that that pharmacist is providing if it's within a pharmacist's scope of practice. So knowing what a scope of practice for a pharmacist is also important, and it is determined by collaborative drug therapy management or collaborative pharmacy practice agreements. So within those agreements, pharmacists are able to bill for implementing, modifying, and discontinuing drug therapy, except for controlled substances, as well as billing for ordering of labs, screening tests, and supplies that are related to drug or disease state monitoring. So that's what Senate Bill 787 is. But the goal behind why this came to be is to increase access to care to rural West Virginians, as well as decrease the burden of primary care provider shortages that we have been seeing across the United States. So, pharmacists have been identified as trusted healthcare professionals with clinical knowledge to be able to provide healthcare services that are often provided by other practitioners or providers. Why pharmacists and why you may not have seen pharmacists already provide these services or expand into providing these services more often has really been that lack of reimbursement for those services provided by pharmacists. So this bill is really aimed at holding commercial insurance plans accountable for reimbursing pharmacists for those services outlined in the bill to be able to increase the amount of services that are provided for by pharmacists and justify adding more pharmacists in this space to be able to help fill that gap in primary care provider shortages and access to healthcare for West Virginians. So this bill has already been passed, and since it's passed in 2020, there have been some limitations that have been identified. So one of those being that insurers are not following billing practices and not being held accountable. It's also been identified that there are difficulties getting pharmacists added to insurer networks and seen as independent healthcare providers who are then able to charge for their services. And lastly, there has been inconsistency with reimbursement rates. So this has been hard and difficult for healthcare systems to be able to identify how much there's going to be reimbursed for pharmacist services. So that's tricky when you're trying to identify how many pharmacists you want to implement to provide these services. So this is really strong and has already started to benefit the health of West Virginians, but there are some recommendations that could help improve it going forward. And this really stems around ensuring fair implementation and incorporation by all healthcare systems and payers and insurers, as well as if you look at the language and trying to expand the scope and allowing pharmacists more flexibility, this can allow more services to be provided by pharmacists and allow them to really practice at the top of their license. So, really having insurers, pharmacists, other healthcare providers, and policymakers work together and sit down and talk through the pros and cons of this could be super beneficial to optimize Senate Bill 787. Thank you for listening to my discussion on this policy brief for West Virginia Senate Bill 787 and hope learned a little bit about what it is and some opportunities for optimization going forward. Thank you.